Good morning, everyone. Good to see everyone assembling today. I'm Dr. John Ward. I'm the director of the Coalition for Global Hepatitis Elimination at the Task Force for Global Health here in the United States. It's our pleasure and privilege to be the secretariat for the UN Group of Friends to Eliminate Hepatitis, and I welcome you to this first meeting of the Group of Friends. We met at UNGA 77 to commit to launching a Group of Friends, and I want to thank the ambassador to the UN for Egypt, Ambassador Osama Abdelhalik, for officially launching the Group of Friends in December that got us on the path to this meeting today. The purpose of the Group of Friends is to express global solidarity toward the global goals for hepatitis elimination, provide an opportunity for member states to come together and share lessons learned and create opportunities for health diplomacy, and to bring other partners to the table that help us build the capacity needed to achieve the goals for hepatitis elimination and avert 7 million deaths from liver failure and liver cancer. We're affiliated with WHO in this Group of Friends and through its New York office, and as well as with the Task Force for Global Health, as I just mentioned. So I do want to turn to two of my colleagues to broaden the welcome of all of you to this Group of Friends meeting. And I'll start with Dr. Patrick O'Carroll, who's the president and CEO of the Task Force for Global Health. Patrick.
Good morning, everybody, and welcome, and thank you for your commitment to eliminating hepatitis around the world. I'm Patrick O'Carroll. As you heard, I'm the CEO at the Task Force for Global Health. The Task Force is really a family of programs that are linked by a common approach, and that is a collaborative, respectful approach that realizes every big challenge can only be taken on by enormous coalitions of different kinds of professionals and organizations working together with a focus on a specific goal. And that marks all of the different programs we have at the Task Force. We have a set of programs in health system strengthening. Our original program began having to deal with vaccine equity, but we have a slate of programs as well in disease elimination. And of course, the program that we're talking about today has to do with hepatitis. It really is an honor to be here at this first meeting of the Friends of Hepatitis Elimination. And I welcome you and wish you all the best with this meeting. I'm here to learn and to meet all of you and to do anything we can to support John and his program and all of you. So welcome and good luck.
Thank you, Patrick. Now I'll call forward Dr. Werner Obermeyer, who's the director of the WHO office at the United Nations. Werner?
Thank you, John, and good morning, everyone. It's really a pleasure to be here with you. I also want to commend the leadership of the Permanent Mission of Egypt, the United Nations, for the creation of this group and for actually already using the group to place hepatitis in the midst of the UHC, the Universal Health Coverage Political Declaration, which was yesterday adopted by the high-level meeting. Hepatitis is mentioned there for the first time, such a document, and this will be a tremendous political impetus in ministries beyond health as we implement the commitments of heads of state, and will be of great value to the more than 1 million people that still die every year of viral hepatitis. Also want to commend John Ward and the Global Coalition for the excellent work in driving the work of this group of friends behind the scenes. Thank you very much.
Thank you very much. When you look at the history of public health, you recognize that global initiatives to eliminate diseases often start with a major breakthrough in medicine. And that was certainly the case for hepatitis, where the momentum toward setting goals for hepatitis elimination really began with the major breakthroughs of the development of curative therapies for hepatitis C. And indeed, the first therapies for a chronic viral infection in the history of medicine. And those developments of curative treatments was made possible by the excellent scientific work leading to the discovery of hepatitis C virus that was first reported in 1989. And it's our pleasure and privilege to have Dr. Harvey Alter with us from the U.S. National Institutes of Health, who together with two of his colleagues, Dr. Michael Houghton and Dr. Charlie Rice, were awarded the 2020 Nobel Prize for Medicine and Physiology for their scientific work leading to the discovery of hepatitis C virus, which has made possible the reliable test that we have to screen the blood supply and to diagnose people early so that they can receive the curative treatments, also made possible for that scientific discovery. I think it's very appropriate for us to hear from Harvey as we seek to translate that excellent science into excellent programs to protect people around the world from hepatitis B and C. Harvey, please.
This is not a podium for old men. I'm going to start with a few slides and then have some comments. But I think the easiest thing would be to start. I thought I'd just run through the milestones in hepatitis C discovery. It all began with non-A, non-B, a very strange name, but that's what we called it. And that was discovered in 1975. So that's 25 plus 23, about something 8 years, 48 years. That's a long time ago. But the discovery led through sequential studies to show that this non-A, non-B agent was actually bad. It was thought to be just a simple transaminitis at first, but it was proof that it could lead to cirrhosis, end-stage liver disease, and then to hepatocellular carcinoma. Big breakthrough came in 1987 when Michael Houghton and the Chiron Corporation cloned the non-A, non-B agent, were able to develop the first test antibody to that agent. That was really the big mover here. And with that test, we were able to virtually eliminate post-transfusion hepatitis in countries that could do the testing. Then came in 2011 these direct-acting antivirals that, as you know, are now really can cure virtually 100%, if not on the first shot, on second trial, second treatment. So it is what's allowed this group to move forward because we now have a way to cure people. So that was that test and treat strategy to eliminate hepatitis C that I'll show you I don't know about the Egyptian effort to actually prove that this could be done. I'll show you one slide of that. But what we still need is a vaccine. We do not have a vaccine. There are a few in the pipeline. But how do you test a vaccine now that we have no animal model? We have can't use the chimpanzees anymore, who was so instrumental in the whole non-A, non-B story. So we had a meeting just last week to talk about CHIM, not chimp, but CHIM, Controlled Human Infection Model. We're going to have to go directly to humans in small scale to test these new vaccines as they come along. It's a complicated slide of CHIM, but basically you start out with an inoculum that's proven to be infectious. Ideally, you get a sample from a person who is acutely infected because at that point the titers of the virus are the highest and they're not yet immunocomplex with antibody. This would be an ideal infectious inoculum. Not easy to find somebody, catch somebody in the acute phase because people are asymptomatic at that point. But I think we will. Then it goes through a complex process that we don't need to go through, but the point being in the right-hand panel is that we can now test infectivity, not test the efficacy of the vaccine, but we can test the infectivity of this inoculum in a chimeric mouse model, human liver inside of a mouse. And we can also test it in culture. So we can test its infectivity titer, and later on we want to know whether we have neutralizing antibody with culture. And then we need volunteers. Somebody's got to volunteer, maybe somebody in this group, to receive this infectious inoculum, because we know we can cure you once you get it. So that's the only reason you can do this, Jim, because you have these curative therapies. Before we even do that, we have proven that this inoculum is susceptible to the treatments, and that you can do that in culture, and that it doesn't have any resistance mutation. And you start out with just a few people, then you expand it, it works, and then you can do a real efficacy trial in a small number of people. Some get the vaccine, some do not get the vaccine. And you're not just looking for infectivity, because the vaccine may not be sterilizing. It may not prevent infection completely, but we think it will prevent chronic infection. Prevent chronic infection, that's all you need to do. So that's where we're going if somebody comes up with a good vaccine. We know that HCV can be eliminated because of these three things. Very importantly, there is no non-human reservoir, so we're not going to get bitten by a mosquito. We're not going to get it from other sources. We're going to get it human to human. We know we have the sensitive test now, which is now becoming point-of-care tests. We can even do point-of-care PCR. So that's going to be making it much easier to project. And then we have the curative treatment. So that we have everything we need to actually eradicate it, except building the infrastructure to do this. That's why you're here today. And Egypt has already, you've seen these slides before, but Egypt has already done this. They screened, tested 60 million plus people. They found 4% to be positive for RNA. Treated over 2 million people, and they cured virtually everyone. I'm sure those few that missed treatment were retreated. I don't have the numbers. It only costs $50 to $150 because Egypt developed their own drugs and they developed their own tests. So the actual tests and drugs became very inexpensive, such that the government could afford to test 60 million people. Last I heard, there were only about another 350,000 people needed to be tested in Egypt to really say it has been eliminated. And it's just a remarkable accomplishment. This is what we want to do everywhere, but I don't know how many Egypts we have in the world. We're going to try. So I just wanted to end with this slide. I was trying to think of what is the enthusiasm. If you had a treatment for any disease, a treatment that would cure somebody 8 to 12 weeks, that had no side effects, that could be taken, how enthusiastic would the world be to implement such a treatment? Well, if it was cancer, we'd be on it like that. Any cancer. We knew we could get rid of that cancer in 8 to 12 weeks and forget about it. If it was HIV, we'd do the same. Everybody would be on board. We'd get rid of HIV with a test and treatment. With Alzheimer's, same thing. Major enthusiasm. TB, a little bit less. It doesn't strike our chord doing these other diseases do. If it's hepatitis C, it's down here. Somehow this disease, because the bad outcomes occur so late after the onset, that you don't, the layperson doesn't put those two together. And that's the message we got. So basically, how come we don't get no? And I'll get back to that in a minute. So that's kind of just the background for the meeting. But I'm impressed that you people would travel so far and have such enthusiasm and join this group of friends, get in on this project, which is doable but extremely difficult. It makes me wonder why everyone doesn't have that same enthusiasm. How often can you participate in a project, eradicate a disease, chronic, fatal disease, and you can eliminate it in 12 weeks, maybe 8 weeks, maybe. You don't get this. It's never happened before. This is our goal. So I'm neither a psychiatrist or neurologist. I don't know what drives the human psyche, not even my own, particularly not my own. But I think humans are wired first for survival, and second for self-interest. There's only a small cadre of humans that can see beyond themselves, the other person, really be involved in something good for humanity, good for global health, and that is doable. So I see this UN group of friends as part of that small cadre, have this vision, willing to work hard to make this happen. Human health and human survival. Thank you so much for your efforts. Forward to today's meeting. Thank you.
Thank you, Harvey. We are a small group, but I'm happy to report it's a larger group than it was a year ago, so I think we're heading in the right direction, and our charge is to make that bar a little bit higher every year, and I think we're on the path to doing that, and the group of friends is critically a part of that effort. So in that regard, I'd like to turn it over to the leaders of the group of friends to give their remarks. As I mentioned earlier, Egypt took the step forward of being the first leader of the group of friends over this past year. And then we have Portugal and Chile who are joining to expand that leadership circle so that we can increase awareness of the group of friends and increase its effectiveness. I wanted to turn over for remarks Ambassador Ahmed Eswahandouili, who's the Deputy Permanent Representative of the Arab Republic of Egypt to the UN. Ahmed.
Your Excellency Dr. Khaled Abdel Ghaffar, Minister of Health and Population of the Arab Republic of Egypt, Excellencies, esteemed colleagues. It's a privilege for me to address you today at this important meeting of the Group of Friends on Hepatitis Elimination. On behalf of the Permanent Mission of Egypt to the UN, I would like to renew our gratitude for the invitation extended by the Coalition for Global Hepatitis Elimination and Dr. John Ward for Egypt to chair this group in its first year. I also thank the World Health Organization, of course, for extending its valuable support to the group's work. Through this group, we hope to accelerate collective global efforts to combat hepatitis and achieve SDG 3 by 2030. Based on a strong conviction of the need to further build political will to ensure the highest attainable standard of health for all, eliminating hepatitis entirely by 2030 remains an achievable target. Today, more than 350 million people live with viral hepatitis. Regrettably, over 1 million people lose their lives because of conditions related to hepatitis and chronic infection that causes liver cancer. This is an issue that must be addressed through strong political will to take adequate action. As many of you may know, Egypt has exerted immense efforts to combat hepatitis C through the presidential initiative 100 Million Healthy Lives. The government and people came together to eliminate hepatitis C, and we managed to conduct screening, as was said before, for more than 60 million people and detect 2.2 million cases, which were provided with the necessary treatment. Incidentally, my own mother was one of those people, so I own this esteemed gathering a great debt of gratitude. Thank you. We will hear further, of course, on these remarkable efforts from one of the greatest pioneers, His Excellency Dr. Khaled Abdel Ghaffar, the Minister of Health and Population of Egypt, shortly. Here in New York, we have an opportunity to mobilize support through this group to enhance our efforts to promote access to hepatitis prevention, care, and treatment, and to utilize this group to exchange information, best practices, and lessons learned on the prevention of viral hepatitis and increasing testing and treatment. We believe that achieving Agenda 2030 for Sustainable Development requires strong and concerted international efforts, especially with the emerging challenges the world now grapples with. To this end, Egypt stands ready to share its best practices and experiences, including in our campaign to eliminate hepatitis. Fortunately, Egypt is today on the path to eliminate hepatitis C through the achievement of almost all World Health Organization indicators for HCV elimination. The World Health Organization reports that since our campaign's launch, hepatitis C cure rate in Egypt has exceeded 95%. We also stand ready to assist other countries in promoting their efforts to eliminate hepatitis. That is why Egypt has expanded its cooperation with African countries at the initiative of President Sisi to provide treatment for more than 1 million HCV patients. Considering the gravity of hepatitis as a global health problem and the need for advocacy with governments and relative stakeholders on prevention, diagnosis, and treatment, it is evident that we can only overcome this disease through international solidarity and cooperation to ensure that we leave no one behind. It is our hope that we can contribute to the promotion of global efforts towards this goal through this group. I thank you.
Thank you so much. I'll now turn to my new colleague, Ambassador Jorge Aranda, who is the Deputy Permanent Representative Mission of Portugal to the UN. Ambassador, please.
Excellencies, dear colleagues, ladies and gentlemen, good morning. It's for us, Portugal, and for me personally, a big honor to be here today with you, and I would like to thank the organizers for the opportunity to address you. It's for us as a country really an honor, but also a joy to join this leadership circle. We've been, as you know, already a part of the UN group of friends, and we are animated by what Dr. John Wood said about the increasing number of members of this group. Now, our participation in this leadership circle also shows, I believe, our solidarity and also our commitment to contributing to eliminating hepatitis. And I believe that this commitment also fits well with the global theme of this year's General Assembly, which is rebuilding trust and reigniting global solidarity. And I believe it also fits well with the overall discussion that we are having this week during the high-level week on the Sustainable Development Goals. As my colleague from Egypt also already mentioned, health is part of those Sustainable Development Goals. But we in Portugal also believe that health is object of a comprehensive view, and we also believe that health is a subject to be addressed in a cross-cutting manner throughout the activity of the United Nations, not only through the eyes of the sustainable development, but also through the eyes of the other two pillars of the United Nations, both peace and security and also human rights. I would not like to steal the thunder of my minister, who will dwell on what Portugal is doing later on, but I would just like to say two more things. One of them is obviously to reassure you of our commitment at the permanent mission here in New York to help your activities, and you can count on us to continue to do so. And with a view to making reality this global vision that Dr. Harvey Alter was telling us so eloquently about. And the last thing was would be to already now invite you to come to Portugal every year, but especially next year, as we will be in April from 9th to the 11th organizing the World Hepatitis Summit. Thank you so much.
Thank you so much, and thank you for calling out the hosting of the World Hepatitis Summit that's going to be convened by the World Hepatitis Alliance, who's with us today. I'll now turn to my colleague, Ms. Andrea Pina, who's the director of the National Program for Hepatitis B and Hepatitis C Prevention in the Ministry of Health of Chile. Andrea, please.
Good morning. Dear friends, Chile is strongly committed to coordinated efforts to eliminate hepatitis B and C. Last year, the Coalition Against Hepatitis issued a universal call to enhance the collaborative relationship among nations. The goal is the joint forces in preventing, controlling, managing, and monitoring hepatitis. Chile has been implemented childhood vaccination for 18 years, sorry. Additionally, we have implemented screening for pregnant women, vertical transmission, prophylaxis, and free antiviral therapies to cure hepatitis D, all guaranteed for law. We urge everyone to embrace tenacity as a virtue and continue working for those who need our attention the most. Thank you so much.
Thank you for that tenacity. Remember, that's one of the words for the day. That's fantastic. Let me turn over to my colleague, Dr. Meg Doherty, to give us a global perspective on why we're here. She's the director of the Global HIV, Hepatitis, and STI programs at the World Health Organization in Geneva. Meg? We have a step. Congratulations, Meg, on the first one to use the step.
I think that's a sign of I'm getting too old and I walk too much. I didn't want to fall down. So it's really an honor, and all protocols observed here, but it's an honor for me to be here and to be representing WHO. I have a few slides, but I think it's to really put it into the context and also to give a very strong shout out to the excellent work that is happening in many, many countries around the world. Oops, let's see if I go back. And you just heard from my colleague, Dr. Werner Obermeyer, that yes, yesterday the universal health coverage political declaration was approved, but we're also sitting in a time of real stark differences from where we were when we started the SDGs, where we may not have as much interest in ending communicable diseases or a lot of external funding because we're worried about other crises that are happening around the world. I don't need to tell you about those. You see them every day. But the good thing is, in this political declaration, with the help of all of you, and I have to shout out to the team that was working on this in also our office at WHO here at the UN, we have explicit language around hepatitis, where here, if you see on page 3 and number E, we still need coverage for viral hepatitis as a leading cause of mortality, 3 million new hepatitis infections every year, 1.1 million deaths. And I think this is important that it's there, and it's also going to be important that it will be something that will have to be monitored within this framework. And you've seen these slides, or some of you, that we have 350 million people living with hepatitis, mostly with hepatitis B. Often we're speaking about hepatitis C, but they're all around the world. And I think we, for so long, haven't really been dealing with this as the pandemic that we see in HIV or in COVID, that we're watching sort of our house burn on fire with hepatitis because the outcomes are so further away from the time of onset of infection. In our strategies, we have very, very, I would say, ambitious goals and targets to reach elimination, but I think we can be inspired by those countries who are doing so, and we'll hear about Egypt today. So really, we have to pick up the pace now to 2030 and beyond. And with the cure and with treatment and a vaccination for hepatitis B, there's no reason why we can't do that. So on this slide, it's busy. We can give it to you if you're interested, but in our strategies, we lay out a framework of how you can get from the impact indicators of reduction of incidence, reduction of mortality at 2020, 2025, 2030, and what are all the milestones and also the programmatic indicators that countries need to achieve in terms of testing coverage, in terms of treatment coverage, in terms of having safe blood, in terms of having OST or harm reduction or needles in exchange program, so that one can actually reach elimination. But where are we? So I think this is a slide you may want to see. This is up on our website. But across the regions, what you'll see on here in the orange is hepatitis C, and the green is hepatitis B. For hepatitis C, the darkest color is treatment, the lighter color is testing, and the light color is where we need to be. So that's the gap. So testing for hepatitis C, somewhere around 20%. And the greatest treatment coverage we've seen from the EMRO or our Eastern Mediterranean region. When you look over at hepatitis B, our testing is somewhere around 10% of where we need to be, and treatment even less than that, 2%. So you can see that where we need to focus and how we can start to pull not only the testing up, the treatment up, and also cover those light gaps that we're seeing in terms of people knowing their status. It reminds me of when we started with HIV. Knowing your status helps us. It's the entryway. And I don't think we think about that with hepatitis C and B. We need to know our status. And that's why for World Hepatitis Day, and with many of you, we were focused on love your liver. You have one liver. Know your status, because you won't be able to get treatment until you know if there's an infection. And we've heard so many times that infections are silent and people don't know until 20, 30 years later. There's also the stigma and discrimination that goes with hepatitis that is much larger than I thought, and perhaps even larger than HIV right now, and we have to overcome that. So we're also talking a lot about integration and UHC and primary care. So how do we do that? So we've already looked at some of the policies, and we have to thank PEPFAR, who's in the room as well, and others, because we're going to build on HIV a bit, but not only. But you can see that already there are countries who are in the green who have a policy of both HIV and hepatitis testing together. And now we have the Global Fund who's willing to pay for it. We also, those in orange, they may not yet have a policy, but they're not yet implemented, but they will implement. We have countries that do this during pregnancy for hepatitis B. Again, a huge opportunity to be able to screen for hepatitis B among people who present for HIV or ANC for syphilis, as well as now we can do co-infection of HIV and hepatitis B around the world. And we have to thank our big HIV programs that are making this possible, and then we can expand to those who are not co-infected. Lastly, we need data. And before, we didn't really know what was happening. We had to take data from different surveys. Now WHO has moved from time where we were looking at data that was coming out of those surveys, trying to make estimates. We're now getting data from 130 countries in the bottom here in that slide, and we'll be reporting out this year. When countries know where they are in their hepatitis infections, I think they can then move towards achieving the goal of validation of viral hepatitis. We also now have criteria. So that's not, we've done a lot of work, and we have to thank Egypt, who's been the forerunner in this. We had criteria put out in 2021. We tested them in 2022, all during the time of COVID. And now in 2023, we have those final criteria. We've had a country who submitted a dossier for validation for being on the path to elimination. And almost there. And just to say, we'll invite you to look at these, but they're comprehensive. It's not just achieving a number. It's about achieving work that looks at harm reduction, blood safety, human rights, etc., laboratory criteria. And we're not going away from wanting to reduce incidence and mortality, but we're actually trying to get to a point where we can measure those numbers and ensure that people themselves are free from hepatitis. Again, these are the path to elimination. We'd like to be able to celebrate if a country is on the bronze pathway, the silver pathway, the gold pathway. What does that mean? That they're building a program, that they're showing us they can do testing, treatment, coverage, injection safety, and all of that will produce impact in terms of saving lives. So I'll just end there to say, lastly, we're so excited that Gavi has unleashed the visa program and we can start working on hepatitis birth dose, particularly in Africa. And we will have new hepatitis guidelines that will allow us to treat more people coming out in November. And I just would like to say thank you very much for the opportunity to share some of this with you. If you'd like any of this information, you can ask John and Lindsay to get it for you. Thank you.
Thank you. All this information will be available on our website at globalhep.org. I think I'm going to do a slight break for the agenda to ask the Honorable Ambassador Masood Khan of Pakistan to come to the podium to give his remarks, just in the interest of his busy schedule. And as you'll be hearing more about Pakistan in a moment, but Pakistan is a country with one of the largest, if not the largest, burden of hepatitis B globally, and it's I really greatly appreciate the ambassador coming to express his support for forming this group of friends.
Thank you so much. Dr. John Ward, Director Coalition for Global Hepatitis Elimination, Professor Harvey Alter, distinguished ministers who are sitting here, ladies and gentlemen, I want to express my sincere gratitude to the United Nations Group of Friends to Eliminate Hepatitis for convening this very, very significant gathering. We have come together to address our pressing issue, strengthening political commitment and global solidarity for hepatitis elimination, hepatitis service integration via universal health coverage. This initiative, led by the Permanent Mission of Egypt to the United Nations, plays a pivotal role in mobilizing political support and advocating access to hepatitis prevention, care, and treatment. It serves as an important platform for sharing information, best practices, innovative models, and lessons learned, fostering a collaborative approach to tackle hepatitis worldwide. The objectives of the group of friends align perfectly with the overarching theme of United Nations General Assembly 78, focusing on rebuilding trust and rekindling global solidarity to accelerate progress on the 2030 Agenda and its Sustainable Development Goals, aiming for peace, prosperity, progress, and sustainability for all. Ladies and gentlemen, today Pakistan stands at a crucial juncture in the fight against hepatitis. According to the estimates that we have, around 12 million people in Pakistan are affected by hepatitis B and C, with 150,000 new cases reported every year. The challenges stemming from unsafe blood transfusions to unhygienic dental treatments to reused syringes are multifaceted. The recent data underscores the gravity of the situation, with increasing HCV rates and steady HBV prevalence. In 2022, the Coalition for Global Hepatitis Elimination launched the National Hepatitis Elimination Profile Initiative, a remarkable effort aimed at expediting our journey towards hepatitis elimination. Under this initiative, the government of Pakistan has set an ambitious target aiming to screen millions of individuals and treat millions affected by hepatitis by 2030. However, this program requires adequate funding to become a reality. Pakistan is committed to addressing these challenges and moving closer to our hepatitis elimination goals. Our response to the COVID-19 pandemic has enhanced testing capacity, improved electronic health reporting, and strengthened coordination among provinces and the federal capital. Some provinces have initiated reporting of diagnosed and treated cases as well. Pakistan deeply appreciates the pivotal role of the international partners, particularly Gavi, in the fight against hepatitis. Gavi has contributed expertise and resources, enabling Pakistan to address this challenge effectively. The collaboration has led to healthcare infrastructure, heightened public awareness, and enhanced healthcare infrastructure. Pakistan's partnership with Gavi, the Vaccine Alliance, primarily focuses on immunization and strengthening healthcare systems in the battle against hepatitis. I'm on the last page. Furthermore, Pakistan has formed partnership with the corporate sector through the Corporate Coalition for Viral Hepatitis Elimination in Pakistan, consisting of 12 leading companies. These alliances strengthen our resolve to eliminate viral hepatitis by 2030. Successful HCV micro-elimination programs have been implemented in both the public and private sectors, demonstrating our commitment to results. Looking ahead, our priorities include updating the national strategic framework, improving surveillance, expanding hepatitis B birth dose vaccination, increasing HCV testing and treatment, and engaging community-based organizations. These steps will bring us closer to eliminating hepatitis as a public health threat by 2030. I want to assure you that Pakistan remains steadfast in its determination and dedication to addressing the challenge of hepatitis and achieving the World Health Organization's global elimination targets by 2030. We are committed to building strong partnerships, both domestically and internationally, to ensure the success of our hepatitis elimination efforts. Together, as a global community, we can and we must eliminate hepatitis, securing a healthier future for all. But before I say thank you, I want to thank Dr. Nidali, who facilitated my presence here, and WHO, which has been doing a wonderful job by demonstrating its leadership across the globe. I used to be Pakistan's permanent representative to the United Nations in Geneva, and there I worked with very closely with WHO and WHA. Thank you so much, ladies and gentlemen.
Thank you very much. It was a very inspiring message about national commitment on the part of Pakistan for a very large problem that we all need to assist in helping them overcome. I'm going to take a few moments now to hear from some international organizations that are seeking to help countries build the capacity for hepatitis elimination. I wanted to start with Africa CDC. Dr. Wessam Mankula, who is the acting head of the RCC North of Africa CDC, and we'll learn what RCC stands for when he comes to the podium here. Thank you.
Okay, so let me start with the question, the RCC. What is RCC standing for? So as you know, Africa CDC, we have our headquarters within African Union Commission in Addis Ababa. Then we have 5 regional coordinating centers, 1 in each region for Africa. So we have 1 in North Africa, in Egypt, then another one East Africa, Kenya, West Africa, Abuja, Nigeria, then Southern Africa in Zambia, and Central Africa in Gabon. United Nations Group of Friends to Eliminate Hepatitis. Dr. John Ward, Director of Coalition for Global Hepatitis Elimination. Professor Harvey. His Excellency, Dr. Khalid Abdel Ghafour, Minister of Health of Egypt. Honorable Ambassador, distinguished guest, all protocol observed. It's a pleasure to be here today on behalf of His Excellency, Dr. John Kaseya, the Director General of Africa CDC. Unfortunately, he couldn't be today with us because of conflicting commitment. During this week, the main theme of UN General Assembly to speak about pandemic preparedness, prevention, and response. And we are seeing pandemic as a sleeping dragon. This sleeping dragon, when it awakes, the earth will shake. And today we are speaking about hepatitis. And hepatitis, it's not a sleeping dragon. It's a silent dragon that is moving globally. In Africa alone, we have over 70 million Africans living with hepatitis C and B. We have more than 200,000 people losing their lives on annual basis because of hepatitis. So we need to take care of this silent dragon before it becomes fully awake. Then it will lead to shaking the earth. In Africa, we have in Egypt Cairo Declaration for Elimination of Hepatitis C. And this is where Africa CDC is standing, getting directives from Excellency's Health Minister of the continent that we need to move together as a continent in order to achieve the elimination of hepatitis C in Africa. This is why Africa CDC established Hepatitis C Elimination Program, and we're currently conducting series of consultations with representatives from member state and experts to develop Africa Hepatitis Elimination Strategy. Will be a unified strategy that will be leading the effort of elimination of hepatitis in the continent. And this is coming from our new public health order vision that is underpinned by 5 key pillars. The first one, strengthening regional and continental and national public health institutions. We need to strengthen our institutional capacity in the continent. This is include National Public Health Institute, Ministry of Health, regional institution to standardize our approach to deal with hepatitis program in the continent. Second, local manufacturing capacities. We need to strengthen our capacity in the continent when it comes to diagnostics, when it comes to treatment of hepatitis, to make this diagnostics and treatment accessible for all African population. Third, workforce development. We need to have well-trained human resources that are able to deal with hepatitis issue. Fourth is domestic financing resources. For us in Africa, we will not stop at looking for resources coming from internationally, but we need to strengthen our domestic resource to ensure sustainability of the programs when they are established in different countries in the continent. Last is partnership, and this is why we value this United Nations group for elimination of hepatitis. We are looking for respectful, action-oriented partnership to achieve this goal of elimination of hepatitis in the continent. And lastly, we have a very good example here, coming from Egypt, one of the African countries that managed to achieve elimination of hepatitis C, or in the process of achieving this elimination. I know that we are expecting in the coming few days, WHO will be declaring that Egypt will be the first countries in the world to achieve the golden tier of elimination of hepatitis C. Thank you for His Excellency, Dr. Khaled Abwar, for reading this, and for His Excellency President Sisi for making a great initiative, this 100 million Healthy Life initiative to eliminate hepatitis. This is one of the success stories that we have in the continent. We don't need each time to go for far east or far west to bring good examples, but we already have a good example within Africa. This model needs to be replicated in other African countries. This is why we're working closely with Ministry of Health Egypt. We organized a study tour for some of the African countries, Ghana, Chad, South Sudan, Cameroon, Angola, and Senegal visited Egypt to learn from their experience and to replicate this in other African countries. Finally, everyone is speaking about preparedness for pandemic X. And really, if we need to be well prepared for the pandemic X, let's invest in the known challenges, and hepatitis, one of the known challenges. Invest in the known challenges to achieve better preparedness and response to the unknown challenges. I thank you.
Thank you very much. There was been multiple mentions of Egypt. I think it's wanted to move a little bit slightly out of order and bring Egypt to the podium. Minister Khaled Abdel Hafar, who's the Minister of Health and Population for the Egypt Ministry of Health and Population.
Thank you, John. Good morning, everyone. Delighted to be here. I think last year I couldn't make it, and today I can see that there is a lot of friends, Dr. Manuel and Dr. Ali, and a lot of ministers and a lot of attendees from permanent missions from different countries. I think every year we're getting more crowd and more coalition. So I think we need to. I've been working like 10 meetings every day since the last 3 or 4 days, attending different activities within the UN. But what happens is most of the time we are talking about things that really very difficult to achieve. And people are talking in different concepts and different backgrounds, and not respecting or not considering the culture or the capabilities of different countries. When they talk about universal health coverage, for instance, when they talk about primary health care, when they talk about climate change, there's a lot of topics that we've been through during the last 3 or 4 days. My point here is we have a success story here in this hepatitis elimination program. If we just followed or we worked in a solidarity, I think we will achieve a great success. And so it's not about talking and about meetings and about people gathering to each other and about traveling different places, but we have an example, and as my colleagues just mentioned, and we worked hard in Egypt according to our capabilities, which is not that much. We didn't have that much money, but I will share with you some of the activities that we've done. Maybe this will be of value of any. But allow me at the beginning also to say a few words about Dr. Harvey Alter because of him we are here today. Because of this guy, when he discovered the non-A, non-B virus. So thank you, sir, for coming. It's always pleasure, and you are inspiring all of us when we see you in this important thing. I remember those days when Egypt suffered from hepatitis C, and nearly all families, in one member of each family, they have a hepatitis C patient in their family, and they are devastating and suffering and in pain and in agony and costing a lot of money. So just to take that from one step of the most prevalent country on earth suffering from hepatitis C to the number one country applying to the WHO for the golden tier of hepatitis C virus elimination, I think that's a model that should be studied quite carefully. And again, we've done that with no big deals, with no big money, with no big capabilities. I have to also talk about John because I think John Ward did a very good job in putting down the UN group of friends when he bring this idea, and even the Lancet magazine recognized that last year and to show the solidarity for hepatitis C in the UN group of friends. But let me take you through this important journey of what Egypt used. We started during the serial surveys in DHS in 2008 and 2014. We've done this demographically in all over Egypt in the 27 governorates. We tried to screen as much as we can in different countries, in the different areas of the country, according to the DHS survey, and we started doing that from 2008. So it has been like around 15 years now since we started our program, and that's in the time of history is not too much to eliminate or to eradicate disease, a global disease, global disease that affects a lot of people, that kills a lot of people. So we've started by having treatment centers, which is more than 170 treatment centers, and we managed to screen 63 million people for HCV during our 100 Million Healthy Lives campaign. And for all of you that are not familiar with the 100 Million Healthy Lives campaign, this 100 Million Healthy Life campaigns is not just for communicable diseases, but it's also for non-communicable diseases. So we've done a lot of surveys for more than 60 million Egyptians all over the governorates. And we happen to facilitate 7,468 health facilities between primary health care, secondary health care, and tertiary health care, so that will be the point of care for those cases. We trained and we worked with more than 60,000 healthcare workers in this program, 60,000 healthcare workers, and they are all well trained to do that during our campaign. And we used screening method at the beginning, but in order to make the more valuable diagnosis, we also used more than 70 labs of PCR, more chain of PCR labs all over the Egyptian governorates. And most importantly is the pharma industry. As John was talking about, this encourages the pharma industry to work with us. And we had like 15 generic products coming out from our pharma industry to work to facilitate affordable treatment. And that's very important when I talk about affordable treatment, because sometimes the treatment is so expensive that nobody can do it. So I think, I don't know who's, I cannot hear, I cannot see what you're trying to do something? Huh? I cannot see that. Okay. So, as I said, I mean, we've done the pharma industry worked with us, the capacity building. We worked with other countries, and this is important because now we work in the political leadership in hepatitis elimination, which we call it the health diplomacy in this area. I believe what we've done in different countries, especially in Africa, like 6 African continents, We work with 100,000 doses of HCV treatment and 100,000 diagnostic tests with our sisters and brothers from Africa, according to our presidential initiatives to work with our African continent. And even beyond Africa, we work with the Asian countries also, and definitely with the UN Group of Friends, and working with the fund pledging conference that John is adopting. So, can you change that?
Can you change, please, slide?
I think they cut for me the. That's another way to. Thank you. So the marathon of hepatitis elimination in Egypt started by political commitment, which I think it's very important to have a political commitment. And that's what happens between 2006 and 2018, when our president decided that we are going to put all the resources for this problem to happen. So political commitment is very important, and that's what happens by prioritization and putting all the resources, resource mobilization. I remember that we've been funded by the World Bank, but the first dollar of the World Bank came after we finished our program, so we managed to work with our own budget. So we engaged all the stakeholders, and global harmonization was also very important, and depending on government funding, and that's a key issue for success. Political commitment is not enough if you don't have a Minister of Finance that is ready and understanding that this is something that will save money for him, because every dollar you pay now will save a lot of money later. And definitely people-centered integrated program, and improving the capacity of the healthcare workers and the commodities, because you can start a program, but in the middle of the program you will out of supply, which we see it everywhere. But how do you sustain and maintain the commodities and the supplies for the whole program all over Egypt? That's another challenge. This is what happens. In 2008, the DHS, and Egypt at that time was 75 million. Our HCV antibody was 14.7% of the population showing antibodies to HCV. Of them, when we go for an HCV RNA and PCR, 10%. And just simply, with the age group 15 to 59, we're talking here about around 6 million Egyptians confirmed to be positive HCV RNA. Going to the DHS in 2015, you can see that the numbers decreased to 10%, but that's not because of the number, but it happens because of the patient aging and the IPS measures. So the prevalence declined to 10% for HCV antibodies and 7% for the viremic patient. And when you go to when we started our program in the 100 million Saha in 2018, now you can notice a dramatic decrease in the number of antibodies and the number of confirmed HCV RNA. And just last year, when we reached 103 million of the Egyptian population, the figures went down to 0.38. So we started by 10%, and now we ended up by 0.38. That's a dramatic change. And you can see here in 2022, where there is an incredible decrease in the viremic patient reaching only 0.38. And when we started 2008, it was 10%. That's a big difference. That's a great success that we have to learn from. And that's why the elimination program milestones was putting 63 million people in total screening, diagnosing 5 million, and treating 4.5 million, and HCC treatment for more than 60,000 for hepatocellular carcinoma. And we've done also a surveillance program for cirrhotic patients. And now our HCC management center went down to 20 because we don't see patients anymore. And that's the good thing about it, because now we don't need to have all these centers of treatment or point of care as we used to have. Thank you, and I'm sorry for taking too much time.
That says it all, and that shows you what's possible when we all pull together and achieve that national commitment, and that was spoken of. I'm going to turn now to Dr. Rebecca Bunnell to talk about PEPFAR, a program that put together highly effective service delivery for HIV, and it's really provides opportunities for integration for hepatitis as well as ways forward of building similar systems for hepatitis elimination. She's the acting principal deputy coordinator of PEPFAR, Global Health Security and Diplomacy Bureau in the Department of State here in the United States.
So, good morning, everyone, and all protocol observed. I'm just delighted to be in this room of people who have done so much in such an important area. I wanted to just reflect for a couple of minutes on some of the things we share across HIV, Hep B, and Hep C. And I think all three are chronic infectious diseases associated with severe morbidity and mortality. And all three are challenging to rally support for and sustain attention to, largely for a lot of the reasons we heard about the silent dragon. I love that. Thank you for putting that term out there. But the silent dragon characteristic of them all. There are a number of things that I think we can learn from each other and the approaches. One is that all three are faced with the challenge of addressing the fundamental gap in knowledge of status that people have. So the need to screen people before they become ill and to treat effectively is something that we've worked on a lot in HIV, and I think we have a lot to learn in a bi-directional manner. Our modes of transmission, including blood transfusions, injecting IUDs, injecting drug use, sexual transmission, mother-to-child transmission, are similar. The predominance of one mode of transmission is different in different contexts, but we share that across all three infections. And because of that, we have a lot of opportunities for leveraging each other's interventions and for taking a more syndromic approach to prevention. I think it's very important for us to also speak to the common threads of stigma and discrimination which run through all of our challenges in these three diseases, and the fact that the social and policy approaches to how we deal with these infectious disease challenges determine a great deal about the course of our progress and how important it is for us to address not just the medical side, but also this social and political context, and to work together across HIV and the Friends to Eliminate Hepatitis to ensure that we use our voices to address the discrimination, the policies that actually drive transmission of all of these diseases. I really, really want to thank WHO for presented some images of their roadmap, the targets that they've set out, but they've really provided, I think, a framework that can help us come together, see where we have opportunities to work together. And I think this is one of the things that's been so helpful for PEPFAR, is to have very concrete global targets, to use our data, to measure our progress, and having the WHO framework for the world would be really, really helpful. Obviously, enormously helpful to have examples of success. We share, in addition to all these characteristics of epidemiological characteristics, we share an SDG with HIV and hepatitis. And to have the example of Egypt, have examples of success, is extremely important for all of us to provide ground truthing for where we go from here. So extreme gratitude to Egypt for what you've done and other countries that have made good progress. I wanted to emphasize perhaps the most profound thing that we share, which is that we share the prospect of being judged by history, by humanity, by our own children in the future. When they ask us, when we had the opportunity, what did we do? Did we act? Did we work in solidarity? Did we look for partnerships? And were we successful? So I want to pledge on behalf of PEPFAR that we will continue to work in solidarity, share our platforms, learn from you, and work together to eliminate hepatitis. So thank you all.
Thank you so much. And in the spirit of transparency, I was a former colleague of Becky's at the US CDC. It was a great opportunity to share the podium with her again. And I go do a little bit of a world tour to see where countries are on their journey toward hepatitis elimination and their efforts to overcome barriers, whether that be financial, health system capacity, public awareness, national commitment, civil unrest, and even invasion, about how they're sticking to the course of making progress toward hepatitis elimination. I want to first turn to Dr. Anthony Nasaya Asari, who's the Presidential Advisor on Health in the Office of the President of Ghana, and has been a close colleague in their efforts to develop a variety of national initiatives. Dr. Anthony, good to see you.
Thank you very much, John. I'll stand also on the existing protocols and bring you warm greetings from the President of the Republic of Ghana, Nana Addo Dankwa Akufo-Addo, who I have the honor to represent at this meeting. Exactly a year ago, I had the privilege to join in this meeting to form this August group, whose objectives align with the determination of Ghana to eliminate viral hepatitis. Ghana is obligated under relevant international conventions to ensure elimination of viral hepatitis. At our meeting last year, Ghana made a great commitment to work with all of you, and especially with the Arab Republic of Egypt, to accelerate the steps to eliminate hepatitis. In line with this, Ghana has elevated the status of the disease in the international health agenda and has continued working with various partners to scale up the response. In furtherance to its leadership, its partnership with Arab Republic of Egypt to assess high-quality treatment for hepatitis C, Ghana launched hepatitis C treatment programs under the Stop Hep C project. In a colorful ceremony in March 2023 in Accra, at which event both the Egyptian ambassador and Dr. John Ward were present, Egypt graciously donated 6,000 bottles of direct-acting antivirals in initial support of Ghana's first decentralized hepatitis C treatment program. And we are very thankful to you, sir. This intervention has brought much needed relief to hundreds of Ghanaians who have been diagnosed with the disease but were hitherto unable to access treatment. Many have completed treatment and many more are eager to start. The beauty of this experience is best described with testimonies of the ordinary Ghanaian who just had to walk from their homes to a district or to regional hospital to receive life-saving medicines for hepatitis C, free of charge. Ghana has learned a lot of useful lessons from this pilot, including the need to expand accessible, useful lessons to accessible point of care or laboratory testing for hepatitis. Ghana is currently using some of these lessons learned to fine-tune the next stages of implementation to ensure that more people benefit. On the World Hepatitis Day this year, the government decision to implement hepatitis B birth dose next year was announced, much to the joy of the women and health professionals. This will come as a major boost for hepatitis B prevention and ensure reduction in the incidence of chronic hepatitis in the country. The Global Fund have also accepted Ghana's proposal for testing all pregnant women and treatment of those infected with hepatitis B as part of the triple elimination approach from next year. The fund is also supporting management of hepatitis and HIV co-infections in key populations. Government is ready to play its part in ensuring availability of trained, motivated health staff and quality infrastructure to implement the needed interventions across the country. Ghana is also aware of the Clinton Health Access Initiative and the Hepatitis Fund in assisting our countries to access to hepatitis medicines at much reduced prices. This opportunity and that opened by our mutual cooperation with Egypt promise to help the country overcome the hurdles that hepatitis case management pose to patients in our country. Ghana is therefore leveraging all these opportunities to eliminate viral hepatitis. As Ghana develops its primary health care structures with networks of practice across the country as its basic unit, and also the massive infrastructure development of 101 district hospitals across the country, the government will ensure availability of hepatitis care within all networks. In conclusion, ladies and gentlemen, it is worth noting the immense technical support of supranational organizations such as African CDC and WHO to viral hepatitis response in Ghana. Ghana would definitely take its pride of place in the global community for eliminating hepatitis. Thank you very much.
Thank you very much. Let's turn now to Dr. Youngmi Ji, who's the Commissioner of Korea Disease Control and Prevention Agency, who will speak about their progress toward elimination in the Republic of Korea.
Good morning, Excellencies, delegate, and colleagues. It is my great honor to speak to you on behalf of Korean government to reaffirm political commitment to eliminate viral hepatitis by 2030. I'd like to thank Dr. John Ward and colleagues from Coalition for organizing today's event and also having the honor of sitting next to Dr. Harvey Alter. I very much welcome global solidarity to eliminate viral hepatitis and commitment from many countries and partners. Today, I want to share with you the Korean government commitment to eliminating viral hepatitis. In line with UN General Assembly's 78th theme of rebuilding trust, reigniting global solidarity, Korean government has implemented a multitude of policies to achieve hepatitis elimination goal. So in addition to national immunization program for hepatitis B, we will further promote the perinatal HBV prevention program, providing hepatitis B immunoglobulin, vaccines, and free testing to infants born to hepatitis B infected mothers, to include a broader range of beneficiaries such as multicultural families and foreigners. In March this year, we announced the first national strategic plan for viral hepatitis B and C control. The primary goal of this 5-year plan is to establish a comprehensive hepatitis control system that covers all stages from prevention to diagnosis and treatment. To achieve this goal, we will expand screening for hepatitis C to early detect asymptomatic cases while establishing a follow-up management system to enhance the linkage to care for confirmed viral hepatitis cases. Korean government offers the national health screening program to all citizens, but it covers only hepatitis B screening. Now we are actively working towards incorporating hepatitis C testing into the national health screening and the linkage to care program, complemented by a tracking system to ensure all individuals confirmed through the screening program receive medical care without exception. So currently, Currently, we are also performing a pilot project to link hepatitis C screening to a care program targeting high-risk groups with hepatitis C, such as IV drug users and inmates of correctional facilities. And strengthening governance and collaboration at the national and global levels would be crucial in achieving hepatitis elimination goal. Republic of Korea stands ready to tirelessly work with the international community in our joint efforts for achieving the UN SDGs and WHO's goal of eliminating viral hepatitis. We are strongly committed to share our experiences and lessons learned in controlling viral hepatitis and key strategies with other member states. Looking ahead, Korean government will spare no efforts in implementing health services to achieve hepatitis elimination, ensuring universal health coverage for all. I look forward to working closely with the UN group of friends to eliminate viral hepatitis and also WHO. I also urge all of you to make concerted efforts in achieving the elimination of viral hepatitis by 2030. Thank you very much.
Thank you very much, Young-mi. Now let's turn to Ukraine and Dr. Olga Mordeska, Acting Deputy General Director, Public Health Center of the Ministry of Health of Ukraine, to give perspective on their country's progress.
Good morning, dear ladies and gentlemen, distinguished audience. I'm really very pleased to be here and thank you for invitation. I am very happy that Ukraine joined this movement and thanks for inviting us. How can I? Yeah, okay. For over 9 years now, Ukraine has been exercising an ongoing war that began in February 2014 with Russia's invasion, annexation of the Crimean Peninsula, and occupation of 2 more eastern regions. But this war became particularly cruel on February 24, 2022. Now Ukraine is standing and fighting bravely against the enemy, but Russian missile attacks are still threatening the entire territory of our country. Nevertheless, we know that we are defending our homelands, our families, and the future of our children. More than 8 million people have been forced to flee their homes and seek refuge in safe regions of Ukraine, becoming internally displaced persons. Another 8 million of Ukrainians have fled to Europe as refugees, including about 5 million of those officially registered. The healthcare system of Ukraine is facing enormous challenges. Many healthcare workers have been forced to leave their jobs and evacuate from dangerous areas, and some of them even go abroad in search of work. This has led to the relocation of the entire healthcare facilities and outflow of medical personnel to the other regions of Ukraine. Among the problems caused by the aggressive neighbor, in addition to the occupation of certain regions and territories and the total front line of 1,300 kilometers that are damaged and destroyed healthcare facilities, difficulties in providing medicines and other medical resources in certain regions, extreme work outload for medical personnel, limited access to medicines, lack of vital medicines, disruption of treatment of chronic illnesses leading to spread of the diseases. The blowing of the Kakhovka dam, a startling crime of the Russian Federation, resulted in the flooding of huge areas of land nearby, dwelling villages, and the city of Kherson. Huge environmental and social consequences await not only for Ukraine, but for the whole world in the future. The actual task as of now are to ensure a reliable area for our defenders and provide access to medicines, care, and services for civilians, continue and reforming processes the European integration and ensure the state leadership in political development and system management. Resume medical services in the liberated territories and return to the state funding for program activities. We continue to work to ensure high quality, accessible and free medical care, support and protect medical personnel, restore services in the liberated territories, return medical personnel and resume logistic chains, renovate destroyed infrastructure, deliver medical equipment and resources to hard-to-reach areas, take care of mental health, both among general population and military personnel. Among the risks caused by the war that are limited access to healthcare facilities, especially on the front line or in the frontline areas, interruptions in the supplies of medicines and equipment, a large number of injuries, and medical care being provided is not always carried out in compliance with all appropriate infection control measures. Deterioration of hygienic conditions, in particular due to the destroyed infrastructure, lack of clean water and hygienic products, increase the risk of infection liquids and objects. For example, due to the explosion which destroyed the Kakhovka dump, the threat of infection with viral hepatitis R has increased in Ukraine. This situation once again emphasizes the importance of medical care and preventive measures in war conditions. Vaccination against hepatitis R in Ukraine is not included in the list of mandatory immunization. This poses a serious challenges for public health, as immunization can help prevent the spread of the virus and reduce impact of the population. Chronic virus hepatitis B and C pose an even greater threat to public health, whereas despite their widespread prevalence, most people are unaware of their status. Prior to the full-scale invasion, it was estimated that 5% of the population in Ukraine was infected with viral hepatitis C, 3.6 of whom had chronic HCV, and 1.5 with hepatitis B. However, it should be noted that these data are outdated now, and we should go through the new calculations. Migration increases the risk of spreading HBV and HCV infection to other countries. In particular, it can be assumed that there are about 4,100 HCV infected persons and 120,000 HBV infected persons. It should be emphasized that most of them may know that they are infected and therefore do not seek medical care. Thus, the military conflict not only deepens the existing problems of infection diseases, but also emphasizes the need for truly effective measures to ensure medical protection and prevention of these diseases in the context of military conflict. Despite the war challenges, we continue to decentralize viral hepatitis services, involving family doctors into the treatment activities. Viral hepatitis programs is being still funded by the state fully. Original medicines for the treatment of hepatitis C virus in pediatric population have been received as humanitarian aid. The viral hepatitis model is being developed in the medical informational system, and we can collect all data now. HCV treatment among key population in drug addiction in OST centers is being expanded. OST programs are being expanded as well. Regional CDC centers are being developed, standards of treatment of viral hepatitis, and being tailored in line with the latest international guidelines. Continuous access to higher quality medicines and ART for patients with viral hepatitis has been ensured, even in the regions where active hostilities are taking place. Public information and awareness-raising campaigns about hepatitis and prevention thereof, importance of HBV vaccination, especially among mothers and children, are being promoted. We are going to do even more. These achievements represent an important step forward of Ukraine towards ensuring access to effective hepatitis treatment and reducing the spread of HCV among the population, including mothers and children, even in the context of the war. To fulfill the Ukrainian commitments and in terms of the solidarity in the elimination of hepatitis represented by the UN Group of Friends, along with the Coalition for Global Hepatitis Elimination, a national profile on the elimination of viral hepatitis have been developed, thanks for that, and being a resource allowing to understand the current stage of the hepatitis epidemic in Ukraine. We are looking forward to continue our work with the member states, the coalition, and other partners of the Group of Friends to stop transmission, prevent liver-related diseases, and eliminate hepatitis B and C as a public health threat. Our goal is to improve a reliable and effective medical protection to all our citizens, despite the difficult war conditions and the challenges arising due to the conflict. Thank you.
Thank you so much. You know, those efforts are truly heroic under very horrendous circumstances, so I really fully salute you in your efforts to maintain public health in Ukraine. Let's turn to Somalia and Dr. Hali Haji Adam, the Minister of Health and Human Services for the Ministry of Health of Somalia, to hear from Somalia, a country that certainly has not been part of large global meetings about hepatitis elimination, so we're very interested to hear your remarks today.
Excellencies, ladies and gentlemen, good morning. I'm deeply honored and delighted to join the UN Group of Friends to Eliminate Hepatitis, a disease that has profoundly affected the health of populations, particularly in low and middle income countries. I wish to express my heartfelt gratitude to Professor Harvey Alter for his tireless dedication to the fight against hepatitis, a disease for which the tools to prevent, diagnose, and treat exist. I extend my appreciation to Professor John Ward, Director of the Coalition for Global Hepatitis Elimination, and His Excellency Ambassador Ahmed El Shandawili of the Permanent Mission of Egypt to the United Nations for extending the invitation to participate in the second meeting of the United Nations Group of Friends to Eliminate Hepatitis. Additionally, I thank the many friends and colleagues in this room who have worked diligently to raise awareness with the public health community, within the public health community, and to our partners and stakeholders regarding the hepatitis situation in our country and its urgency in the pursuit of viral hepatitis elimination. Our nation grapples with numerous challenges, including recurring droughts, conflicts, floods, leading to significant number of internal displaced persons, socio-economic disparities, natural disasters, political instability, and underdeveloped healthcare system. Over the past decade, our healthcare system has made significant progress, primarily driven by substantial investments from the private sector and contributions from the international donors. In November 2022, the Ministry of Health of Federal Government of Somalia established a dedicated office to enhance the life of individuals with hepatitis infections and to lead national mission to control the spread of hepatitis and ultimately eliminate the disease. As part of our efforts, we are proud to have joined the UN Group of Friends to eliminate viral hepatitis. Hepatitis is indeed one of the neglected communicable diseases in Africa. Despite its high disease burden and significant impact on public health across the continent, limited attention and resources have been directed towards addressing it in our country. Eliminating hepatitis in Somalia, especially in the newly liberated area that were stronghold of terrorist group of Al-Shabaab for decades include limited healthcare infrastructure, limited accurate data and surveillance, limited access to testing and treatment, low level of awareness and stigma, limited financial resources, and relying on global funding and donor support. Additionally, international donors and organizations have often prioritized other diseases such as HIV, AIDS, malaria, and tuberculosis. Furthermore, financial barriers, including high costs associated with testing and treatment in both private and public health care facilities, have made it challenging for the majority of Somali citizens to access testing and treatment services for hepatitis B and C. We know that most of hepatocellular carcinoma is increasing nowadays in Somalia as we observe it, and most of the causes pursue to post-viral hepatitis B and C. To address these challenges, as a government, we are committed to implement comprehensive national hepatitis elimination strategy. This strategy involves collaboration among government agencies, NGOs, international organizations, and community stakeholders. Efforts should focus on improving the challenges that I highlighted earlier. Additionally, integrating hepatitis service into a broader healthcare system and addressing the specific challenges faced in conflict-affected regions are essential steps toward hepatitis elimination in Somalia. Ladies and gentlemen, the theme of this forum, rebuilding trust and reigniting global solidarity, accelerating action on the 2020-2030 agenda and its sustainable development goals towards peace, prosperity, progress, and sustainability for all, holds immense significance for our collective commitment to eliminating hepatitis and ensuring access to prevention, care, and treatment. As we convene here, guided by the World Health Organization Global Health Sector Strategies on viral hepatitis, it's imperative that we recognize the urgent need to expedite progress towards the UN Sustainable Development Goals and World Health Organization goal of eliminating hepatitis by 2030. To achieve this mission, the UN Group of Friends to Eliminate Hepatitis aims to champion equally in access to hepatitis services within existing healthcare systems and to raise awareness at the diplomatic level. We must leverage the attention and support of donor agencies, development banks, philanthropic partners, and national governments to assist low and middle income countries in their efforts to eliminate hepatitis. As we transition from pandemic response to recovery, it is crucial that we establish new avenue of dialogue and collaboration to advance universal health coverage, pandemic preparedness, and reduce health disparities and inequities. I commend the Coalition for Global Hepatitis Elimination program under the Task Force for Global Health for their tireless efforts in assisting countries worldwide in planning, implementing, and evaluating national and subnational programs geared towards accelerating progress in hepatitis elimination. Their commitment and dedication have played an instrumental role in driving positive change. In conclusion, I wish to reiterate my gratitude for the privilege of being part of the esteemed gathering. I eagerly anticipate engaging in productive discussions, sharing best practices, and exploring innovative solutions that will bring us closer to our shared vision of a world free from the burdens of hepatitis. Thank you all for your attentive presence, and let us unite our efforts to eliminate hepatitis and forge a healthier and more equitable future for all. Thank you.
Thank you so much. Welcome to the UN Group of Friends to Eliminate Hepatitis, and we look forward to deepening our collaborations with you and your colleagues in Somalia. Let's move now to Malaysia and hear from Dr. Hasnina Ibrahim, who's the Deputy Director of Communicable Disease Control in the Disease Control Division of the Ministry of Health. Dr. Ibrahim.
morning, Excellencies, ladies and gentlemen. Thank you to Dr. John Ward, and I'm honored to sit at the same table with Prof. Harvey. First of all, on behalf of the Director General of Health Malaysia, I would like to thank to the organizing committee for giving Malaysia the opportunity to speak and state our commitment towards eliminating hepatitis in the country. I have slide.
Just 1 second, they're uploading them.
Over there. In our effort to combat and eliminate hepatitis, Malaysia has taken initiatives to strengthen and improve the national coverage of hepatitis prevention and control program, as well as increase the accessibility of testing and treatment of hepatitis. The National Strategic Plan on Hepatitis B and C from 2019 till 2023 was developed and endorsed on July 2019 as reference document towards achieving the goal. The Ministry of Health Malaysia is currently reviving and reviewing and finalizing the next National Strategic Plan for the period of 2024 until 2030. The hepatitis B vaccine has been administered to children at birth, 1 month and 6 months of age under the National Immunization Program since 1989. The coverage of the first and third hepatitis B immunizations have reached more than 95% in 2022. Malaysia has been certified of achieving the 2017 Western Pacific region target of less than 1% hepatitis antigen prevalence among children 5 years of age by 2011. And in November 2020, Malaysia switched to a hexavalent combination vaccine providing protection against diphtheria, tetanus, pertussis, polio, hepatitis B, and Haemophilus influenza type B. This vaccine is now administered at the age of 2, 3, and 5 months with a booster dose given at 18 months of age. And starting on January 6, 2022, the Malaysian government has provided the hexavalent combination vaccine free of charge to all children under 7 years old, including the non-citizen children. Malaysia is dedicated to expand a nationwide universal antenatal screening for hepatitis B in 2024, aiming to ensure early diagnosis and treatment for positive mothers and reduce vertical transmission to their babies. Ladies and gentlemen, Malaysia has gone through a very challenging journey in its efforts to eliminate hepatitis C. As well as we are all aware, hepatitis C is a curable, but the price of DAA-based treatment, which was developed in 2011, was so high and became a major barrier. In August 2017, the Malaysian government decided to issue a compulsory license for government use to import generic sofosbuvir, and the effort has brought down prices of DAA-based treatment to less than $300 in Malaysia, ringgit Malaysia 1,400 per course. This move also allows Malaysia to increase hepatitis C screening and treatment, including decentralization HCV treatment at the primary healthcare settings. On the 4th June 2021, Malaysia, as the first country in the world, has approved the use of Ravida tablet 200 mg or Ravidasvir hydrochloride 200 mg in combination with other drugs to treat chronic hepatitis C. Recently, on 2nd August 2023, Ravidasvir is included in the WHO Essential Medicine list as a direct-acting antiviral DAA for chronic hepatitis C treatment in adults. As of June 2023, we have treated over 20,000 patients using DAAs with SVR ranging from 95 to 98%. Decentralization of hepatitis C screening and treatment has been further expanded to 687 health clinics in 2022 as compared to 25 in 2019. Hepatitis C screening using rapid diagnostic kit was made available in 2019 and has been made widely used since then. And the use of RDT has facilitated screening tests, especially in primary healthcare, and in turn speed up the process of confirmation and treatment of hepatitis C. Malaysia is now focusing in reaching the key population and the unreachable group in the screening and treatment of hepatitis C. In January 2020, Malaysia has piloted hepatitis C screening and treatment in prison, where 17% prisoners were found to be anti-HCV positive. As of end of December 2022, hepatitis C screening and treatment in prison has been expanded to 19 facilities. And hepatitis C screening was also initiated and expanded at 25 facilities under the National Anti-Drug Agency. Hepatitis C screening using RDT are also being conducted by community, our NGO, through our harm reduction program in our effort to increase awareness, screening, and treatment among key population, especially people who inject or use drugs, men who have sex with men, as well as sex workers, and etc. And finally, Malaysia is committed to eliminate hepatitis through various strategies, including political will, central coordination, R&D exploration, inter-organizational partnerships, treatment decentralization, and affordable as well as accessible drugs and vaccines. These strategies have led to significant progress in the country, ensuring sustainability and navigating towards the goal. Thank you very much.
Thank you very much. We often speak about the essential components of effective programs, and they were very effectively laid out by Dr. Ibrahim. Thank you again. Let's give a moment back to Portugal for the Minister of Health, Manuel Pizarro, from Portugal, to give some remarks about the status of elimination in the country.
Good morning to you all. I'm very pleased to participate in this meeting of the UN Group of Friends to Eliminate Hepatitis. In Portugal, liver diseases, including, of course, comorbidities as excessive alcohol consumption and fatty liver, is one of the most important causes of early mortality. If we have these liver diseases, those deaths caused by liver cirrhosis and those related with hepatic cancer, we have the fourth leading cause of death. That's because of that we get so much importance to the fight against hepatitis, which are very important in that context. We are doing more and more tests to hepatitis B and hepatitis C, and our goal is to assure that everybody, when has a contact with the health sector, has the opportunity to have a test, with the main objective that assure that everyone will do a test at least once in the lifespan. That's very important because we are dealing with a number of people that is essential to get there to achieve eradication of hepatitis C and B. Our work is internationally recognized, but we are aware that we have a lot of things to do. We want to assure our commitment to meet the goals defined by WHO for 2030, to improve the knowledge of the epidemiological distribution pattern and the integrated response of viral hepatitis in Portugal, aware of the problems of the small groups which must be attained to get that objective. People incarcerated, people who use drugs, people in very poor living conditions as homelessness people. We are working hardly to meet these people. Improve the literacy of the general population concerning viral hepatitis. This issue has already been debated today, is very important. From the perspective of a more global framework of hepatitis, namely as oncogenic entities, leading to early mortality aggravated by less healthy lifestyles. We must speak about that and give people literacy about that if we want that people is engaged in the idea of eradicating hepatitis as cancer or HIV or other diseases. Train health professionals on viral hepatitis in its global dimension, namely the reduction of the risk of progression to liver cirrhosis and hepatocellular carcinoma. Promote hepatitis B vaccination for the adult population, and improve the awareness and knowledge about treatment of hepatitis B and C in Portugal. And of course, promote immediate access to hepatitis C treatment at the time of medical prescription. Of course, it's amazing the progress that we have achieved and that was shared in this meeting due to progress in scientific knowledge. Thank you, Dr. Harvey Alter, about your magnific work, because of political commitment and because of solidarity. But at the same time, we have an immense amount of work to do. And that's because of that I urge you to get to Lisbon in April 2024 to the World Hepatitis Summit. Thank you very much.
Thank you so much. I'd like to turn now to Dr. Aletze de la Torre Rosas, who is the director of the National Center for the Prevention and Control of HIV and AIDS in Mexico. The Minister Pizarro spoke about health equity and that's the ultimate goal of disease elimination and health equity. And I think you'll see some examples of that from the progress in Mexico.
Hello, everyone, and good morning. So, for me, it's a pleasure to present to you a summary of the National Program for the Elimination of Hepatitis C in Mexico. This program is a patient and community-centered focused program, and that's the key. We are optimizing our resources, human resources, but also the communities. And we also think that if we don't have the HIV and STI components, but also other strategies such as tuberculosis, prevention control, if we don't include harm reduction, mental health, addictions, it's going to be super difficult to achieve our goals. And also, it's important to have information, real-time data, for us to guide the progress of the program. So in 2019, we were able to convince the finance ministry and got finally the opportunity of creating a national program with a primary healthcare approach. This national program was born due to a national procurement that allowed us to have universal access to all people in Mexico, considering that liver disease is one of the leading causes of mortality and 60% of transplants in the country are due to hepatitis C. So the pillars for the elimination of hepatitis C in Mexico are: number one, universal free access to testing and treatment, unified program across all healthcare systems and a unified registry, a primary healthcare approach, health literacy for both healthcare workers and the community, as well as innovation and research, and of course, strategies focused on high-risk groups, including harm reduction. So we were, by the end of 2019, we had the money, we had the drugs, we have these new ideas, and then the pandemic started. And we had two options. Number one, to wait until the pandemic was over. Number two, to define that it was impossible to wait because hepatitis cannot wait. And we opted for the second one and tried to start the program, and we did, right in the beginning of the pandemic. So in order to implement the program, we had a preparation ranging from analysis of the counties and the data that we had available then, up to engaging with the different political actors, including the governors of each state. We went to every single state of the Republic, and we had conversations about why this is important and to start this program during the pandemic. Also, we had clear goals of which were our targeting groups. We decided to start with people living with HIV, considering that it was kind of a low-hanging fruit for us, and then going into high-risk groups, and finally reaching general population in high prevalence counties. We also defined that as this was a primary health approach, we needed a strong telementoring strategy to achieve. And for me, this is the slide that represents the progress of the program. In 2019, we had less than 50 units across the country to treat people with hepatitis C. And as you can see, now we have almost 2,000 units. The majority of them are primary healthcare units where people can get diagnosis and treatment, so they don't need to travel. They can just go to the nearest unit to get that treatment. And we also have the rest of the network for helping people to achieve this. In the last couple of years, we were able to screen and test for hepatitis C over 2 million people, including people in jails, and we had 38,000 people reactive, 28,000 with viremic, and we were able to treat them as well. So we're progressing. You can see that we're going to communities, we're going to indigenous population. We have different approaches according to each of the states. We also developed a national guideline that includes not only hepatitis C, but also hepatitis B, and also a part of mental health and harm reduction, because we believe that that's a main pillar for the strategy of hepatitis, several online courses, and 70 clinical leads that are essential for us for the telementoring strategy. Of course, we have the person-centered registry. This is a registry that allows us to have real-time data. I can track every single strategy from the screening till the patient is cured, and I can track every 15 minutes. Sometimes the healthcare workers are not so happy about that information, but you can see it here. We also believed in public benchmarking, so we have that information as public data, and we also encourage and recognize the work of the top ranking states. So that creates this activity of comparing and learning from others. And every week we trace and track their progress, and you can see that every single state is progressing within their own pace. We had completed the economic analysis thanks to PAHO and CDA Foundation, and of course international comparisons. One day we want to be like Egypt, but it's important to have that and to be able to have your own country profile. Thank you to the coalition, because after doing our first profile, we realized that there were gaps, such as hepatitis B, in our program, so we have changed that and improved that as well. We believe that there's responsibility if we were to achieve the elimination goals, and therefore there's a need of addressing the migrant community. And it's important to us in Mexico, all people in the national territory, they can receive free access treatment, including migrants, and so far we have reached 154 people. And of course, if we have other pandemics, disasters, wars, and other areas, we need to make sure that hepatitis progress is not stopped. And therefore, we need to work towards resilient systems that are essential if we are to eliminate hepatitis and not to leave anyone behind. Gracias.
Thank you. We'll have some remarks to end our world tour from Professor Saeed Akhtar, who's the chairman of the Pakistan Kidney and Liver Institute and Research Center. who's a champion for hepatitis elimination, as you'll soon hear, in the country.
Good morning, ladies and gentlemen. John, thank you for inviting us for this beautiful get-together, and it's been extremely important learning experience. For Pakistan, after Egypt, that's #1 country in the world now. And we are not very proud of it, but first I want to congratulate Egypt for what they have done and paved the ways for us. But the most important thing is, ladies and gentlemen, that Pakistan now has the highest burden of the hepatitis C in the world. However, people of Pakistan and the state of Pakistan has made a determination that we are going to eliminate hepatitis C by 2030. And I just want to share the letter. This is the letter from the Prime Minister of Pakistan stating that he will be standing behind the program. And this is the letter from the Foreign Minister. Both of them wanted to be here, but unfortunately they could not be. So just want to tell you, we have developed this roadmap where we have now 35 billion rupees from the federal government and 35 billion rupees from the provincial government. Both of them will work together, and together we're going to eliminate the hepatitis program. I think the most important thing in this entire game is the political will, and I'm very glad to report to you that I think Pakistan has now a very strong will. And this National Steering Committee that is going to run the show will be headed by the Prime Minister, and all the Chief Ministers will be there. So we inaugurated hepatitis prevention and treatment program, or elimination program, very recently in 2023, and our Prime Minister was there on the forefront. And then we conducted a seminar where everybody from the world came in, and Egypt was also there, and we finally made the ways, and this is how we are going to run the campaign. So Pakistan has the largest population, we realize that, but we have made our resolve that we are going to eliminate it, and with the help of all people sitting in this room, we can do it together. Thank you.
Thank you so much. That closes this program. I hope you come away with a sense of increased commitment to hepatitis elimination, because it reveals how countries, even though they're at a different place in their journey, they're all making positive steps toward that elimination goal. Albeit we went a little bit over time, needless to say, for this session 1, and in that regards, I apologize for that. But I think it really reveals the enthusiasm when I reached out to countries to see if they would like to be part of this program. The answer was an enthusiastic yes. And regardless of them wanting to be acknowledging their barriers or acknowledging the success, their willingness to come forward, as a show of solidarity for hepatitis elimination, and joining this group of friends is a real testament of what we can do together more effectively than what we can do separately. So I really encourage us all to continue to work together to eliminate hepatitis and look for opportunities to help each other in that regard. All of this information will be available on our website, including the slides. I want everyone to return at 11 o'clock, where we'll be looking at progress toward achieving the SDG for eliminating hepatitis B among children through hepatitis B birth dose vaccination and other related strategies, so that children are not becoming infected with hepatitis B, developing chronic hepatitis B, and having a 1 in 4 chance of premature death from liver cancer and liver failure in later life. So thank you again for all of your participation, and please return at 11 o'clock for that next session. Thank you so much. And if we could have in fact everyone, but if we could particularly have all the speakers and to come forward for a group photo, I would greatly appreciate it. Thank you. Thank you. I'm sorry to run you. Oh, Patrick, you're back. Yep. Please. You tell me. You tell me. It's going to be about, be a lot of people. You want me to move this? Okay.
African mission is
Taking care of
taking care of it.
Thank you so
Yeah,
much.
no, thank you. Thank
Good
you.
to see you. Good, I haven't seen you.